What happens if your organization is bought or buys another organization? What happens to you? Hey everybody, it's John with Contract Diagnostics, and we're talking about mergers and acquisitions today of hospitals and systems. We're talking about consolidation in healthcare. We hear about this all the time, and we've seen a lot of it over the past 20 years. So is this trend going to continue, or is it going to slow down? There's been a lot of things in the press lately about the St. Luke's and BJC merger here in Missouri for St. Louis and for Kansas City. You've seen Kaiser and Geisinger announced plans. You've seen Henry Ford's health system and Ascension announce plans. You've seen deals fall apart like Sanford in South Dakota with Fairview. You've seen a lot of other deals come together, go through, or come together and fall apart. In fact, in Q3 of 2023, there were 18 deals, big deals, that were announced. There was only 10 in Q3 in 2022. So they pose this question: do we think this trend will continue to accelerate, or will it slow down? And a lot of the thought leaders in the space said hospital agreements and mergers and acquisitions will continue to increase. Consolidation will continue to happen. Economies of scale will continue to get bigger. So what does all this mean for the physicians? Well, first off, I think that you're going to see a lot of non-traditional mergers and acquisitions, maybe partnerships even. You'll see Microsoft come in. You'll see Amazon Health come in. You'll see Walmart look at what they can do to play with these organizations in terms of creating a space that they can work together from. We've seen organizations like Amazon and Walmart try to do it on their own, and they've been seemingly unsuccessful. So I think they'll look to an established organization for help in a local market. I think you're going to see technology come in and play more partnership roles. Maybe not from an acquisition perspective, but from a partnership perspective, which I think will increase a lot of ability to adopt technology in healthcare. But what does all this mean for you, the physician, the contracted physician with one of these organizations? Well, most likely nothing near term. There might be some consolidation in terms of systems, in terms of electronic health systems. You might see changes to your benefits, which may happen immediately, or it may be a delay. Oftentimes, when these large organizations come together, there's kind of like a smoothing out period. 2 years, a year will go by where things will run as normal. And as they slowly make their way down to your department, they will start to change, they will start to modify, they will start to hopefully make things more efficient. Could it impact your compensation? Maybe. Will it be better for your system and for you personally? Potentially. We had another episode or a podcast that we recently did on the cost of electronic health records. Well, as these organizations come together and get collective ability to negotiate, hopefully they can get better prices on these things. They can reduce costs. They have more negotiating capital when it comes to payer contracts. I look at all of those things as a positive for the organizations and the health systems itself. Now, hopefully when they consolidate and merge, we have less executives. So there's less CEOs, there's less office staff to pay, if you will. I know those are typical high overhead for many organizations, and they'll have more to allocate to the physicians who are the ones actually providing patient care. That may be just a wish that I have, but hopefully they turn out to be better for the physicians. Does it increase your negotiating capital or not? I don't know, and I think it's too early to tell. We've seen physicians being a strong position in a lot of great markets over the years, and I think having a good executive team on your end, such as us at Contract Diagnostics, can only help in those discussions. I think as we see changes to non-competes, as we see consolidation with facilities, you have changes to malpractice insurance and premiums, I think all of those things are going to be beneficial for physicians in general. But they may not actually impact your paycheck right away. So what will impact your paycheck? Maybe they'll have better marketing ability to bring more patients into you. Maybe they'll have better technology to make you more efficient, or be able to pay a support staff better wages to bring you more in tune with who you're working with every day. And at the end of the day, I don't know. But will this trend continue? I believe it will. And will this impact you? Maybe not on the surface immediately, but downstream this will impact every physician. And as you are offered an amendment to your contract, or a change to your compensation schedule, or a modification to your call agreement, feel free to reach out to us here at Contract Diagnostics, and we'll be able to help with whatever's going on, whether it's your small community-based hospital or a mega merger where they're going to change how they're paying you. I'm John at Contract Diagnostics, and I look forward to talking with you soon.